A clinical trial is basically an experiment, a scientific experiment that's done in human beings. And they can be important for many reasons. They can help us to get access to a new drug, to treatment, to a potential vaccine, or to health care. So they can help us, but they can also hurt us. They can also help us give knowledge to future people with AIDS and HIV.
When you come onto a clinical trial, are you going to be given active drug, or is someone just going to be playing with your life?
What I found really disturbing at the time was actually that I found even my doctors weren't really sure. There's different opinions all over. This one says, no, you got to go now. This one says, no, but later.
Are you actually going to be guaranteed clinical care? Okay, or are you just being used as a guinea pig? What does that clinical care and that good trial process involve in terms of ethics, science, clinical care, audit process, ongoing assessment?
Well, the first 3 months was hectic. Had lots of rashes, had lots of acne, I had terrible headaches, nausea, so bad actually that I could not work longer.
Don't make anybody at the clinical trial make you feel like they're giving you charity. That is wrong.
There's constantly the kind of reminder almost like, this is a study drug and you're very lucky.
They need you. Remember, they're asking a question. Unless they have me or Greg or people like you in the clinical trial, they're never going to get the answer.
That I understood from day one, and that's why I actually insist on my doctor being very straightforward, very honest. I actually hate the kind of soft talk or kind of, you're going to be all right, you're going to be okay. I want to know.
It might not benefit you. It might be no different. The drug that you get may be no different from the sugar pill. It might not work. It could even harm you. There's no 100% guarantee that in the clinical trial you're going to get better.
All the drugs do have side effects, okay? And side effects can happen in up to 10% of people, or sometimes more, like the diarrhea. But in 90% of people, they may not happen. And we have had people who've had such bad side effects that even though their CD4 has gone up, they have wanted to stop their therapy because they feel so sick. But it is few. It is not everybody. And for most people, these treatments do have benefit rather than harm.
I've been in a clinical trial for 4 years of a protease inhibitor called Virusept, AZT and 3TC. And then I went to my own doctor to get a drug called Imodium, which is for diarrhea. Because this drug, the protease inhibitor, which is an antiretroviral, gives me diarrhea. And I just wanted you to see the bottles so you know what they look like. I go to a clinical trial site to the university every month, and they give me drugs and they take blood out of my arm to see how I'm doing. And I'm going to pass around one dose. I take 9 pills twice a day, so 18 pills a day. The blue pills are the protease inhibitor. The white pill is AZT and 3TC combined into one. And the little brown ones are Imodium, the antidiarrheal, to protect me against the side effects. And you can take a look.
Now, we have 30 places for people every 2 or 3 months. And you know how big our epidemic is. So the opportunities we have to offer people are, they are small.
And so, particularly in South Africa, we look for trials that have what we call rollover protocols.
We argue with the companies for ongoing therapy, and at the moment, they are giving us ongoing therapy for as long as the treatment is working for you as a patient.
However, it is important to remember that clinical trials are not primarily about providing access. They are certainly, as you say, used to provide access, but they are primarily about testing medication.
I-viral load, I made 21,000 acres in before the trials. You see the focus, I did 395. The trials na go June, but in acres, I did viral load 5,000. Got down go when the trials, I-viral load 50. CD4 count 895. As trials just said.